readers of Endoscopy, thank you very much for this invitation to this video presentation. My name is Carlo Jung. I'm a physician specialized in gastroenterology. At the moment of the study, I was working in the Department of Gastroenterology and Digestive Oncology at the University Medical Center of Göttingen in Germany. Right now, I am attending in the Department of Gastroenterology and Digestive Endoscopy at the Hospital of Forlì, Italy. For the study, we had a large net of co-workers at our own hospital in Germany, consisting of colleagues in our gastroenterology department, which are Dr. Idris Vedi, Steffen Kunsch, Volker Elnrieder, our surgical colleagues Annegret Müller-Dornieden and Michael Gadimi, Fabian Kück from the Department of Statistics, and Ali Saif from the Department of Radiology. Our French network consisted of the gastroenterologists Maximilien Barré, Rachel Hallit from the Hôpital Cochin in Paris, Melanie Calmels and Diane Geur from the Department of Digestive Surgery, Hôpital Saint-Louis, Paris, Ulrika Chaput and Marine Camus from the Department of Gastroenterology at the Hospital Saint-Antoine, Paris, Jean-Michel Gonzalez and Marc Barthé from the Department of Gastroenterology, Hôpital Nord, Marseille, Jérémy Jacques and Romain Legros from the Department of Gastroenterology at the Dupuytren University Hospital, Limoges. The title of our study is Endoscopic Internal Drainage and Low Negative Pressure Endoscopic Vacuum Therapy for Anastomotic Leaks after Oncologic Upper Gastrointestinal Surgery. The idea of this study was born when I performed an internship at Hôpital Cochin in 2018 in Paris. In Germany, the use of the isosponge system for gastrointestinal leaks is a common practice, whereas in France, pigtail placement is more or less the standard of care. As one of the major endoscopy centers in Paris at Hôpital Cochin, I was lucky to see a large variety of patients suffering from leakages after upper GI oncologic surgery. The idea was to compare these two methods in a retrospective manner, as outcomes seemed to be favorable in both. At that time, there were not large data for pigtail placement for patients after oncologic surgery, nor comparisons for these two methods available in literature. Overall treatment success was significantly different between both treatment groups, accounting 100% for internal drainage and 85.2% for vacuum therapy. Median number of endoscopic procedures were significantly less in endoscopic internal drainage, with 2 versus 3 in endoscopic vacuum therapy until leak closure. Median treatment duration was significantly higher in endoscopic internal drainage, with 42 days when compared to EVT with 17 days. These differences were in part due to the different technical treatment properties. Both methods are highly promising endoscopic treatment possibilities. Still, both methods are completely different in their endoscopic approach, mechanism of action, and in their clinical follow-up. In our opinion, it is important to show the potential of both methods alongside in these critically ill patients. To our knowledge, this study contains one of the largest cohorts in patients with leakages after upper GI oncologic surgery, treated with endoscopic internal drainage using pigtails. Next steps are developing prospective trials in which patients need to be followed on a prospective basis. Low negative pressure EVT and pigtail placement could also be combined in certain cases. Different pressure levels for low negative pressure EVT should be investigated, and finally, clinical scenarios need to be defined when to use EID or EVT for better results, as for example investigating different leakage sizes. Pigtail placement and EVT for anastomotic leakages after upper GI oncologic surgery are both highly effective treatment solutions, probably each with their own indication. More studies, in order to confirm this effect and their own effectiveness, need to be performed in the future. Thank you very much for your time, and we hope to be able to enrich this interesting field of endoscopic treatment research with our study.